It is a disease that slowly robs a person of brain function and memory. Alzheimer's is progressive, and modest improvement can be had with medications. But as Michelle Skierman tells us this morning, there's a lot of excitement now about a new homegrown therapy.
Doing crosswords and things like that.
As a former teacher, Lucille Neyron isn't used to being the student.
So we're going to start with some phrases.
But these weekly sessions are enjoyable for Lucille, who admits dementia is slowly causing her memory to fade.
Sticky notes all over the place, those little yellow things. Oh, I need them. I use I don't know how many packages a week.
She's hoping by exercising her brain, she'll forget less often. With the help of her good friend, familiar words, numbers, and puzzles challenge Lucille, and more importantly, jog her memory.
Two to tango.
Perfect, exactly right. It takes two to tango. Very good.
You like the tango?
Yes, I do. How about you? Have you tangoed?
Yes.
You do?
Yes.
Really? They target the program specifically or as close as they can to the history of the client. So, for example, Lucille was a teacher, and so the questions would be about teaching and that kind of aspect of things, as opposed to construction work or something like that.
We know that Alzheimer's disease really originates in the hippocampus.
The program is called the Ashby Memory Method, named after its founder.
What tells us that the program's working is the feedback that we get from the families.
Ashby says work with the brain injured shows the brain can retrain itself to work around its deficits. In Alzheimer's disease, vital brain cells die as plaque builds up. Patients don't actually lose their memories, they just have a hard time retrieving them.
Literally, in layman's terms, we're unable to connect the dots. So really what we're doing is we're reinforcing those natural pathways, those neural pathways that are connecting the information together. We're not trying to teach the brain new information, we're just really helping it along and finding the information.
A study conducted by the company showed a 12 to 14% improvement in memory test scores. Lucille has just started. In her case, it's too early to tell if it's having any effect. But by keeping her mind active, she's hoping to preserve the memory she has left.
An apple a day
Keeps the doctor away.
Oh my!
It's there. Yeah.
The program is paper-based because most seniors prefer paper to computers. By 8 weeks, the company says there is a noticeable difference in memory, which translates into improvements in daily living. 6:39 now, and this is the usual time when we bring you the guys from Acumen and Your Money. We'll just mention this morning, we've given them a bit of a break on a Monday, so we won't be hearing from Rob and Sheldon today. We'll make up for it and give you an extra special forecast for your Monday morning talk.